Hello, everyone. Thank you so much for logging on to today's webinar, Living Well Online Health Series, Hypertension, all about managing high blood pressure. This web series is brought to you by 5210 Plus Gallatin and Bozeman Health. My name is Danica Comey, and I work at Bozeman Health as the Community Engagement Coordinator. We are so excited to be offering our online Living Well series and sincerely thank you for your engagement and participation today. Before I turn the presentation over to our amazing hypertension team, I first want to cover some basics about using Zoom. So our presenters will present for 20 minutes, and then we'll have 5 to 10 minutes available for question and answer. Everyone has been muted upon their entry to the webinar. Please keep yourself muted during the presentation. After the presentation, there will be an opportunity for Q&A, and at this time, we invite you to unmute yourself so that you can ask your questions. If you are having any tech issues, please use the chat box feature, and that goes directly to me as the facilitator, so I can communicate with you and we can get those tech issues resolved. This webinar is being recorded, and it will be shared on Bozeman Health's YouTube channel, probably by midweek next week. Finally, I encourage you to complete our post-presentation survey, which will be emailed to you later today. And then check back into Bozeman Health's website, which is bozemanhealth.org/community education, to see our upcoming Living Well presentations. You can also follow us on social media. We have Facebook and Instagram accounts for both Bozeman Health and 5210 Plus Gallatin. So now it is my pleasure to introduce Bozeman Health's hypertension team. Sonia Clausen is a clinical pharmacist practitioner practicing at Bozeman Health Internal and Family Medicine. She graduated from the University of Montana in 2017 and completed her PGY1 pharmacy residency at Bozeman Health in 2018 and has since been practicing as a clinical pharmacist for Bozeman Health. She's the lead pharmacist for the RN Pharmacist HTN Clinic and a preceptor for pharmacy students and residents. Lauren Robison has been a nurse at Bozeman Health since 2016 and works in both the internal medicine clinic as a nurse navigator and as a nurse in the RN Pharmacist Hypertension Clinic. Lauren enjoys partnering with patients to help them get their blood pressure under control by creating and meeting their personal goals in a patient-centered approach. And then our third presenter, Angela Jennings, is a primary care nurse manager for Bozeman Health. She graduated from Carroll College in 1982 and has been employed at Bozeman Health for the past 38 years. She helped develop the RN Pharmacist Clinic program, developed the RN HTN course to prepare clinic nurses to see patients in clinic, and enjoys seeing patients in the hypertension clinic. Alrighty, thank you so much.
Thank you. Hopefully everyone can hear me. So just again, my name is Sonia, and I'm the pharmacist for the RN Hypertension Clinic. So we're really excited to have you on today. Today, really, we're going to talk about hypertension, what it is, and what you can do about it, just everyday little things. Sorry, they're having a little overhead speaker issue in the background, so I apologize for that noise. So let's get started. So hypertension is high blood pressure. Sorry, I think someone's trying to call the intercom system. Anyway, so hypertension is another name for high blood pressure. Blood pressure is really the force exerted by your blood against your vessel walls, so the walls in your blood vessels. So you can kind of think of your blood vessels as a garden hose. So the more water that's running through it, then you can have like blood pressure. And if you have sustained pressure running through your garden hose, sometimes that hose can get kind of worn out and cracked and kind of harden up. And the same thing can happen to your blood vessels. So if that happens, long-term increased pressure can cause a variety of health problems. So it can cause heart attack, increase your risk for having a stroke, increase your risk for kidney disease. If your blood vessels are hardening up in your brain, it can actually increase your risk for dementia. And even you have little tiny blood vessels in your eyes that if they have too much pressure in them, then you can actually go blind from too much pressure for too long of a time. So it's really important. The thing about blood pressure is that you can't feel it. So a lot of times it's considered a silent disease or a silent killer because you don't feel that your blood pressure is high. So it's something that you have to monitor at home to kind of know how it's doing. So how we monitor is with a blood pressure cuff. So it's just really important to kind of know your numbers. It's important to know too that everyone's number and everyone's goal is going to be a little bit different. These are goals that were set by the American Heart Association, but there are a couple other organizations that have their own guidelines. So it's a great conversation to have with your care team about what number you should be at and where you should be. But currently the normal blood pressure for a healthy adult is below 120/80. So that top number is called the systolic blood pressure. And so that is the pressure against your blood vessels when your heart is actively beating. And then the bottom number, or the diastolic blood pressure, is the pressure against your blood vessels when the heart is at rest. So when your heart is beating, it makes a higher number, the top number, and then when your heart is resting, it has a lower number, or the bottom number. So 120/80, and these are all millimeters mercury, just a unit of pressure measurement. Elevated is between 120 and 130 over 80. And then high blood pressure, there's two stages. There's stage 1 and stage 2 hypertension. So stage 1 is 130 to 139 over 80 to 89. And then stage 2 is 140/90 or higher. So if you have stage 2 hypertension, so over 140 or 90 or higher, then you're really at increased risk for heart attack, stroke, and those other adverse effects that we talked about. So it's just important to kind of know where you stand with these numbers. So hypertension is really important worldwide. So these are statistics from 2014, so they're a little dated, but they still hold true. So 1 in 3 American adults has high blood pressure. A lot of them, and this could be even a lower number because these are patients who are diagnosed in medical charts. So this number could be actually underrepresentative because, like I said, it's silent, so you don't feel it. So a lot of patients have high blood pressure that might not even know it. And this high blood pressure contributes to 1,000 deaths per day. Which if you take into like the coronavirus, this is more than that. So it's really serious, and it's something that should be important to everyone. So even reducing your blood pressure just by even a little bit, a few millimeters mercury, which a lot of these 12 to 13 millimeters mercury reduction can actually be implemented with lifestyle changes alone, in addition to medication as well. But even if you reduce your blood pressure by 12 to 13 points, you greatly reduce your risk of stroke by about 40%. You reduce your risk by about 25% of both coronary heart disease and death from cardiovascular disease, so like heart attacks. And then death from all causes decreases by 13%. So it's really important to make sure that you get your blood pressure at your blood pressure goal. And then unfortunately, only about half of patients, or 47% of patients, have their blood pressure at goal. So that's kind of where our hypertension clinic comes in, is we really want to reach out to these people and really kind of have them focus on this one disease state and get that under control so that we can help reduce their risk of these diseases and adverse effects. So just a brief description of our hypertension clinic. There's a pharmacist and a nurse team. The nurses have one-on-one patient appointments to kind of individualize and have patient-centered care, to set goals with the patients and make sure that they're following up, and we can actually adjust meds and titrate meds as well too. So it's a pretty great program.
So let's bring it back to hypertension in Montana. We looked at hypertension in the U.S., and Montana is in keeping with those statistics. Over 300,000 Montanans have hypertension. That's nearly a third of the state. And again, these are folks that have been diagnosed with hypertension. There are many, many that are unaware that they have hypertension. 52% of Montanans over the age of 65 have hypertension, and it is very common in this age group. And it's kind of a matter of time because those vessels have been working for you for 65 years. And they're going to have some, not decay, sort of want to say decline in their efficiencies just by virtue of age. The other thing we know is that up to 50% of the patients do not stick to treatment options. So this is being a human being, I think, mostly. However, what we know is if we can be supportive and help folks find that way that allows them to continue with healthy living styles and taking their medications as directed, then the outcomes are definitely better. So that's a big piece of our RN pharmacist hypertension clinic, is helping folks set goals that are achievable, and then also helping them realize maybe what their barriers are to those changes. So in our community, Bozeman Health Primary Care has over 8,000 patients with a diagnosis of hypertension. Again, those are people with a diagnosis. Clearly, it's much higher than that if you consider the folks that have not been diagnosed. We also know that of these, 35 to 50% of patients with hypertension, only 35 to 50% are enrolled. So we know there's medications that can help us with our blood pressure, but we also know that lifestyle modifications are hugely important in controlling blood pressure. And the beauty of the lifestyle factors and modifications is it actually is great for your entire body, and the American Cancer Association recently came out with how important these lifestyle modifications are to prevent cancer as well. So it's just really a healthy way of living. And it's also individualized. An 89-year-old is not going to exercise the same as some of our 40-year-old patients. Nor are some of our 40-year-old patients able to exercise as much as their peers because they have an underlying condition. So it's very personalized. So some of the things that affect blood pressure: exercise. We know that if you exercise regularly, this is going to impact your blood pressure. It's going to bring it down. And diet is another very key factor here. So we know that if we eat potassium-rich vegetables, we consider the DASH diet or the Mediterranean diet, which are basically diets that are rich in fruits and vegetables, lean proteins, and a kind of a whole food approach where there's less processed foods consumed. In terms of diet also is the sodium intake. We'll talk more about that. So sleep is very, very important in maintaining blood pressure and lowering blood pressure. Interrupted sleep, restless sleep, sleep apnea, all contribute to elevated blood pressure. Tobacco use, of course, raises our blood pressure, and stress is also a huge factor in blood pressure. We've seen during this pandemic time that maintaining some of our lifestyle modifications and healthy living have been more difficult. The stress of the pandemic has derailed us a little bit in terms of some of those self-care measures. But as nurses in the hypertension clinic, we are able to touch base and provide some support and perhaps some redevelopment of a plan to reach your goals. So the healthy diet, and this is really, I would say, common sense. However, I would also say most of us don't eat this way. It does take some effort to get 6 to 8 servings of grains and 4 to 5 servings of vegetables and 4 to 5 servings of fruits. That's a lot of fruits and vegetables. But there are ways to just ease those into your diet. Maybe you have an apple midday and maybe you have an orange in the afternoon. Just real simple little changes like that can set you up for success. So the other thing we like to talk about is maybe preparing vegetables and putting them in containers for the whole week, and then you just take them to work with your hummus and you're good to go. You got a whole serving of veggies there. We like to limit red meat, saturated fats, sweets, and sugary beverages. And again, that's common sense, but sometimes we have to really look at it and say, I do eat more sweets than I realized, and that's something I can improve on. Water is huge. Our whole body, all of our cells are bathed in water, fluid that keeps things running, our joints moving. So water is very, very important, and oftentimes we miss opportunities to drink water, and we're running a bit short. In addition to that, Montana is a very dry state, and we tend to be a little dehydrated just based on that. Add a little summer heat, and we're dry for sure. So try to get more water, and there's lots of little tips we've come up with that work for folks, and sometimes it's as simple as have your water bottle in your car, so you're drinking water while you're driving. And yeah, that works. Now we know in the pandemic era, with masks arriving on our faces, it's getting harder to drink your water. So I think awareness is our first step on that one. We recommend limiting your caffeine intake. Caffeine is a stimulant and will raise your blood pressure. 1 cup of coffee a day is fine, but if you're drinking coffee all day and then having some Coca-Colas, it's starting to add up. So another thing to be aware of. Alcohol is a little bit tricky because it will make your bedtime blood pressure look great if you've had a couple beers, but in the morning you will notice a spike. So alcohol being a depressant can lower your blood pressure immediately after consumption, but the bad thing is you will then have a bump, more elevated blood pressure than usual. Okay, can you hear me better now? All right, so dietary recommendations. Salt is sometimes a very easy place to start with lifestyle modifications, and we recommend a daily sodium intake of 1,500 milligrams or less. So this little label we have here demonstrates how tricky that can be. So we have a label that has a serving size of 4 ounces. Therefore, the container contains 4 servings. However, those are itty-bitty servings, and you think you might just have to have 3 of those servings. And then you can see what your sodium ends up being. 440 milligrams times 3, since they're only doing it per serving. Very tricky. The other thing is low sodium is not defined as if it's less than 500 milligrams, it's low sodium. So a product can have low sodium on its label and actually have more sodium than its regular item. I was looking at Triscuit boxes just recently, and there was the low sodium option, the light salt option, and the regular. And the low sodium option actually had more sodium than the light salt option. So it really does pay to look at those labels. It's kind of fun too. You're just being a scientist and really discovering all kinds of new things. The last thing that I'm going to talk about is get moving, so exercise. And as I said, we do want to meet people where they're at. We want them to be able to exercise. We want them to move. So some folks, that might be walking to the mailbox and back because they haven't been doing that. And maybe after 2 weeks of that, they're ready to walk further down the block. So we're helping them. We're hoping that we can help them expand their exercise, expand their flexibility and their ability to move and enjoy, to get outside, to be in Montana that we love. So some suggestions are focus on things that you're more likely to do. So I don't really like to ride bike that much. That's not going to be my go-to. I do like to hike. So let's find out what you like to do, and let's capitalize on that. And then maybe we'll explore some things you haven't done before you may find very enjoyable. Having a workout buddy is also very helpful. It can be very motivating. It can help keep you accountable. I don't really feel like walking today, but Joy's depending on me. I'm going to walk. Fitbit to count your steps, that's always an option, and folks do like to do that. And then one of the blessings of COVID is there was all sorts of things that moved online. And some of that is fitness classes. When some of the gyms were closed, they provided fitness videos. But those videos are still available in some apps, and I would encourage you to consider those if you don't prefer a gym. There's a huge variety of all sorts of different types of exercise, whether it's Pilates or yoga or resistance or cardio. So with that, I'm going to turn it over to Lauren. Thanks.
Hi guys, I'm Lauren, and we're going to continue just talking about a few additional lifestyle modifications and just things that can help your blood pressure. So a big one that I don't think that people always necessarily think of relates to their blood pressure is getting really good sleep and having a good sleep routine. So we say at the very minimum of 6 hours a night is the recommendation. And then we had a really awesome lecture with one of our sleep specialists here at Bozeman Health, Dr. Osmansky, and he taught us all sorts of things, but one of the biggest takeaways that we remembered was, even if you can add in 30 more minutes of sleep each night, that actually significantly can help your blood pressure and decrease your risk of heart attack or stroke. So, adding 30 minutes seems a lot more doable than actually you need to add in, 2 more hours. So starting little by little. And then, like Angela said, insomnia, interrupted sleep, restless legs, sleep apnea, those are all things that can increase your blood pressure. So sleep apnea is really something that you should be screening yourself for, or, you can talk with your doctor about. But some common symptoms of that are daytime drowsiness, really loud snoring, waking up with a headache, a dry mouth, maybe your partner or significant other is telling you that you're waking up like gasping in the night, that kind of thing. So really important to address those things if you do have them. If you do have sleep apnea, you are having drops in your oxygen levels at night, and then subsequently that is increasing your blood pressure. So really important to be aware of that. So just a few little tips about your sleep. Trying to develop a sleep routine, and by that we just mean more like having a set wake time, a set sleep time, and not, going to bed at 8 p.m. one night and 1 a.m. the next night, because your body just can't, quite regulate that as well. Really trying to cut back on your screen time, both phone and TV, iPad, etc., while you're in bed. Regular exercise also has been shown to help you get better sleep. And then, this one kind of seems obvious, but keeping your bedroom a place that's actually a good place for sleep, like quiet, dark, a good temperature, that your body will be more comfortable at, as well as prior to bed, avoiding really large meals, caffeine, alcohol, at least a couple of hours before bedtime. And then just to tie in with the last slide about sleep apnea, if you do have diagnosed sleep apnea, very important to wear your CPAP every single night, because that significantly, helps your blood pressure, and overall people say that, it just improves their quality of life and they just feel better and have more energy. So just some tips about stress management, which Angela talked about. In COVID, we know that this has been an increased stress on top of our already just kind of normal life stressors that we're used to. So there are several apps out there, and you guys might know of different ones, but a few that we have personally tried as well as recommended to some of our patients through the clinic is Happify, Calm, Headspace. Some people for their stress really benefit from different things, journaling, exercise, deep breathing, those type of things, really just taking that time for yourself, stepping away. And then if you do have that support from, whatever your community is to you, whether that's a significant other, family, friends, talking on the phone, texting, etc. So whatever that kind of is, again, more individualized, what helps you. And then tobacco. I think we all at least have probably heard, we know that we always encourage smoking cessation, and nicotine and the other chemicals in tobacco can increase your risk of high blood pressure, stroke, and heart attack. And nicotine, not only just in cigarettes, also chew and like e-cigarettes or vapes. So in all of those products. So when someone is ready to quit, we really just want to support them however we can. Everyone is a little bit different in that approach too. So whether it's, can we hook you up with the quit line? Can we hook you up with a counselor or some type of other, acupuncture or therapy? Can we get you in to talk with your primary care provider? Because sometimes, in addition to these other resources, maybe a medication is appropriate for you. So again, we really are just, wanting to meet patients where they are. And even if we can just help them start to, cut back from a pack a day to, a half pack a day, start where the patient is and work on goals with them. And then obviously we know we just gave you a lot of information about just all sorts of different lifestyle changes, sleep, exercise, diet, etc. So we know that can be overwhelming for people. and that we really recommend, if we're like, where do I start with all of that? Because we know that making changes is hard. It's part of being human. So when we talk with our patients and ourselves, we definitely say, let's do like a small attainable goal, and let's really focus in on like, one or two things. We're not going to change 10 things right now, but, maybe could we get you moving, a little bit? Can we start that walking? Can we start cutting back on the salt, etc.? And these changes, they definitely don't just happen overnight, and you'll have, kind of times when things are going better, and then maybe a few times when stress happens and things just kind of happen. And I guess our biggest thing is we want to keep supporting people through that. We want you to get support from whoever your kind of support system is. And then just remembering, celebrating the successes, because even though it might seem just like a little win, but getting out and walking 2 times this week, like that's a big change, and that is something to be, you need to pat yourself on the back a little bit too. And little by little, the maintenance will add up. So with that, we just want to open it up and see if anyone has any questions for us. We'd love to answer them.
Thank you all so much for the lovely presentation. So I do want to be mindful about time. It is 1 minute until 12:30. So if you have to jump off the call, that's okay. Otherwise, please unmute yourself and ask a question to our presenters.
Hi, yes, I do have a question. I was diagnosed with high blood pressure, and I have put into practice everything that you guys have listed on there. I keep my sodium levels under 1,000 each day, and exercise has gotten a little bit questionable lately because of the COVID and being trapped in my house for the last 2 months. But my question is that once I've been diagnosed, is there going to come a point when I can actually make it go away? I do take medicine every day, the very lowest dose, but I want to get off the medicine. I want to make this go away. Is that ever going to happen?
That's a great question. Thank you for asking that. So the one thing about hypertension or high blood pressure is that, unfortunately, it is a lifelong diagnosis. So even though your blood pressure might be at goal or less than, in the normal range, it still was high previously, so that does still increase your risk slightly. The one thing that is, lifestyle changes can really reduce your blood pressure, usually up to about 20 millimeters mercury. And sometimes that's enough, but sometimes our darn genetics get in the way, and family history. And so there are a lot of genes and family history that can contribute to hypertension and high blood pressure too. So unfortunately, if you are maximizing and implementing all of your, lifestyle strategies and it's still a little bit elevated, some people just need a little bit of blood pressure medication. And actually, you're doing a lot better than the normal population. So the normal population, most patients with high blood pressure, I would say, I think it's like 85% of them are on 2 agents for blood pressure at maximum doses. So the fact that you're just on lower doses of medication means that you're kind of already ahead of the curve there, because the majority of patients are on 2 agents at max strength. Did that answer your question?
Yes, it's not what I wanted to hear, but yes, you did answer my question.
Do we have any other questions out there? I have a question for the hypertension team. Could you speak a little bit more about home blood pressure machines? Specifically, I'm thinking about the wrist cuff versus the upper arm cuff, if there's a difference in that, and then if you have any brands that you'd recommend.
So yeah, that's a great question. Typically, we do say that an arm cuff is preferred over a wrist cuff. They're just generally more accurate. And we do generally, a lot of our patients ask, can I just check it at the grocery store? They have the one back by the pharmacy. And we tell them they can, but again, we don't know the last time that one was actually validated. So we don't really love that. We would prefer if they were to get their own home arm cuff. And then we like them to bring it into our clinic when they see us or when you see your doctor, whoever, and we will validate it against, we will do a reading here. Then we validate theirs just to make sure they are getting good readings. And then a brand that we really like and have found like very reliable as far as like when we validate it, like almost 100% of the time, it's very good. It's Omron, and it's spelled Omron. So that is generally our go-to, and that's when you can, a lot of people who do use the internet, you can just get it, Amazon, something like that, or most like Walmart, Price Right, those kind of places carry that brand too. So a lot of our patients already have those.
Thank you. Excellent. Any other questions? Alrighty, great. Well, I want to thank our hypertension team for your presentation today, and I want to thank all of our audience members for participating. I will be emailing out a post-presentation survey. If you just take a quick minute to finish that, complete that, that'd be great. And then also this will be posted to Bozeman Health's YouTube channel. So thank you all so much.
Thank you.